Okay, ladies and gentlemen, dear colleagues, here in the lecture hall as well as in the virtual room out there, I'm very happy to welcome you all to today's talk of the Robert Koch Colloquium on climate change in public health. My name is Thomas Ziese. I'm a medical public health professional and deputy head of the Department of Epidemiology and Health Monitoring, where the RKC Office for Climate Change and Health is located as well. I'm very much looking forward to today's contribution to our colloquium, which will be presented by Dr. Aleksandra Kazmierczak. Nice to have you here. Aleksandra is an expert in climate change and human health at the European Environment Agency, EEA, in Copenhagen, where she coordinates the European Climate and Health Observatory. The Observatory is an excellent health information system that provides diverse and relevant information on this topic. It would definitely classify as a best practice model for information services in this area. It covers a broad range of facts, information, and knowledge, country profiles, and extensive databases on indicators on climate and health. Aleksandra has previously focused on urban adaptation to climate change and broader environmental health inequalities. Before joining the EEA in 2017, Aleksandra carried out research in the field of human geography and spatial planning at the universities of Manchester and Cardiff. She was focusing on assessing social vulnerability to climate change and the role of green infrastructure, I like this word, green infrastructure for human health and well-being. Social inequality and vulnerable groups are a public health focus of the Robert Koch-Institut for a very long time. The same is true for the area of climate change and health. So we are very interested in hearing your experience of the interaction of those two public health areas. Aleksandra, I'm very happy you are with us today, and we are looking forward to your talk, Impact of Climate-Related Hazards on Health and Well-being of Vulnerable Groups in Europe. Aleksandra, the floor is yours.
Thank you very much for the introduction, and thank you very much for having me here at the Robert Koch Institute. It's always a pleasure to be in Berlin, and the pleasure is double today because it's my first presentation to a live audience for 2.5 years. But I, of course, very warmly welcome the participants online as well. So as mentioned, the focus on my presentation today is the vulnerable people and the social inequalities in relation to climate change. In this talk, first, I just wanted to introduce myself, where I come from, to also set the context and the boundaries for the presentation. I would like to talk about the vulnerability and exposure of different social groups to climate hazards, and finally focus in the responses in policy and in practice in providing the solutions to the vulnerability and exposure of various groups. So where I come from, I'm working at the European Environment Agency. We are based in Copenhagen in Denmark. And it's one of the EU agencies, and our job is to provide the decision makers at various levels of governance, but also the general public with robust and independent environmental information. We are very much a network organization. We work with the networks of country representatives in our 38 member and collaborating countries, and also with a network of experts in scientific institutes in various fields. So we work at the sort of interface of science and policy. We collect the data and analyze it, synthesize it for policymakers. So that's what we do. And here, just as I mentioned, to set some boundaries for the talk, it's an European institution, so the scope of the vulnerabilities and so on will be discussed in the European context. And also, as you could probably also hear from the introduction, my background is not really in public health, so I'll be mainly focusing on the environmental determinants and the environmental side of things rather than the health side of things. My job is to coordinate the European Climate and Health Observatory. It's an initiative that was launched in March last year, and the main aim of the observatory is to collect and produce and collate the knowledge on climate change risks to human health and also on the solutions to those, or the preventative actions and adaptation solutions. It's an online platform, but it's also a partnership of various organizations in recognition of the complexity of the problem and that not a single organization has a key to solving the issues of climate change risks to human health. And what we want to do is to facilitate the learning between the different organizations and to facilitate the sharing of the knowledge and the good practices and the data and examples. When I say we, it's not a royal we, it's the partnership running the observatory. So it's the European Commission, mainly represented by the DG Climate Action and then DG Health and Food Safety and the European Environment Agency. And we are working closely with then other European agencies such as ECDC and EFSA, with the World Health Organization for Europe, with Copernicus Earth observation systems, both in terms of the climate change and then atmosphere monitoring service, as well as with the Lancet Countdown Group, which is a global network of researchers focusing on climate change risks to human health. Now, more precisely, we are working with Lancet Countdown in Europe, which is a regional part of this group. So the subject of the talk today is about the impacts on vulnerable groups. And the way we understand how these impacts are emerging is drawing very much on the IPCC framework of how climate risks emerge more broadly. So the assumption is that for the risk to happen or for the impact to happen, we need to have three elements. Firstly, the climate hazard, such as heat wave or flooding. Secondly, the exposure to this hazard. So, for example, living in a flood risk area or living in a house that is easily overheating. And the third aspect is the vulnerability. So it's the inherent characteristics of a person or a population that make them more prone to negative impacts from a given climate hazard. And this vulnerability can be further split into sensitivity, so the more personal characteristics such as age or health, and the adaptive capacity, which is all the factors that make someone less or more capable of preparing for, dealing with, or recovering after a given climate impact. So the groups that are vulnerable to climate hazards, and we're talking here about a variety of hazards, heat waves, flooding, allergens related to pollen, infectious diseases, air pollution associated with wildfires. Climate change has really a broad range of consequences for our health. The groups that are commonly recognized as being more vulnerable are the elderly, for example, due to the general frailty and diseases associated with an old age, some problems with thermoregulation, and so on. People with pre-existing health issues, for example, cardiovascular diseases, respiratory diseases, renal and kidney-related issues, diabetes, and so on. The list is quite long. Children, firstly, through their dependence on the parents and on the family situation, but they are also really affected when it comes to mental health, both by the extreme weather events, but for example, the issue of climate anxiety is quite widespread among children and young people, and being concerned about the future. Pregnant women, through the metabolic rate and then the weight gain associated with the fetus might be more vulnerable. But there are also groups that might be more vulnerable through their limited capacity to act, such as, for example, groups of lower socioeconomic status, which might find it difficult to afford flood insurance, for example, or electricity associated with mechanical cooling of their home. Migrants and refugees, groups that do not speak the official language, for example, and cannot understand the warnings and do not know which authorities they can discuss things with. Or socially isolated person that might not receive the information and the help that is needed in an emergency such as flooding or fire or heat wave. However, what we find, especially when looking at the European context, we are such a diverse continent with such a diversity of socioeconomic situations and cultures, is that there are various groups that may be vulnerable to climate-related hazards because this vulnerability is very context-specific. For example, when we look at people who don't own their flats or homes, they may be limited in the changes they can make to the built environment to make it more resistant to, for example, heat or flooding. Also, in some countries, like in the United Kingdom, private rented housing is of the worst quality compared to social rented housing or owner-occupied housing, and therefore might be more prone to overheating or, for example, to poor air quality associated with molds and other issues that might become worse with the warmer and wetter climate. Similarly, when it comes to pensioners, in some countries, they are one of the more financially deprived groups. In other countries, they are the ones that are still enjoying the benefits of the previously existing pension systems. And so on, the single-parent households or the single-person households, the social isolation or having the additional burden of caring for others in the event of emergency can make these groups vulnerable. Similarly, the ethnic minority groups, people tend not to be vulnerable by coming from a given ethnic background, but through the role that is sort of assigned to this particular ethnic group in a given society. And women and girls, again, it's a very different situation of being a woman living in a rural Romania or being a woman living in a center of Stockholm in terms of the vulnerability and the capability of dealing with extremes. So with any assessment of vulnerability, I think we need to be very, very aware of the local context when allocating the groups that may be vulnerable. But looking at just these sort of very basic aspects of vulnerability associated with age and health, and also the fact of living in urbanized environment, if we look at the vulnerability as function of those three things, Europe actually emerges as the most vulnerable region to high temperatures among the other world regions, according to the Lancet Countdown assessment. The high prevalence of diseases, of cardiovascular diseases in some parts of Europe, respiratory diseases, diabetes and kidney diseases, for example. Then aging society combined with high level of urbanization means that the vulnerability is high, and it's been increasing over the course of the years. The exposure of the elderly populations is also increasing. What we see on the left graph is the increase in the land temperatures in Europe, really showing the sort of big increase in temperatures since the beginning of the century. On the right-hand side graph is the exposure of the elderly populations to heat waves, and the colleagues from the Lancet Countdown indicator, Lancet Countdown group developed this indicator looking at the total number of days that vulnerable people here, people over the age of 65, have been exposed to heat waves, and how it deviates from the baseline situation. And we can see that the combined aging and combined with the changing temperatures can mean substantial impacts to health. What we can also see are the regional differences in exposure across Europe. What these maps, that could be a bit larger probably, are showing is the coincidence between the levels of long-term unemployment, that's the left map, and the proportion of people over 75 years old on the right side map, and the number of cooling degree days. So that's the total number of days multiplied by the number of degrees that are needed in terms of cooling to bring the temperature down to a comfortable level in buildings. And of course, the demand for cooling is the highest in the Southern Europe. And that's also where we see high levels of unemployment and high proportions of people over 75. In terms of the impacts, there are impacts on the mortality during the summer, and what we can see from the European Mortality Monitoring Network is that we do have these small but substantial mortality peaks in the summer. So the graphs are showing the mortality in two age groups, over 85 years old and 75 to 84. And they show that whilst the winter mortality is higher, there are still these sort of visible peaks in the middle of the summer. So that's the example from summer of 2018, showing how much the summer mortality deviates from the annual average mortality. And what we can expect in the future? Well, Europe is aging quite rapidly. The rapid aging is expected over the course of the next 20 years. Then it slows down a bit, but we can expect a high proportion of people over 85 and a high proportion of elderly people in general. On the climate side, we see projected a big increase in the number of health-related heatwave days. So the heatwave days where there is also high humidity. And we can see that the number of days in the south of Europe can even exceed 50, 60, 70 days a year. So the exposure is likely to be much higher. And there are some projections of the possible future impacts across Europe, that without mitigation of climate change and without adaptation, some estimates from the Joint Research Center of the European Commission are looking at up to 90,000 of deaths annually. Just to put it in the context, at the moment, the total number of heat-related deaths that's been sort of officially recorded has been about 90,000 over the course of 40 years. But I put a little question mark there because, of course, that's assuming that there is no adaptation, and adaptation is happening, and we are hoping that it will speed up in the future as well. Changing the subject and looking at another vulnerable group, I mentioned that children are a group that is vulnerable to mental health impacts, and it's associated with the mental traumas, experiencing an extreme weather event such as flooding or wildfires, and losing possessions or losing a loved one can be quite traumatic. But there is also an increasing body of evidence looking into the feelings of eco-anxiety or climate anxiety and the general worry about the future among young people. There was an interesting study carried out across the globe, looking at a sample of 10,000 people, from young people and children from various countries. And the findings were rather astonishing. The findings were that almost 60% of the children and young people were extremely or very worried about climate change, and nearly half of them were negatively affected by those feelings in their daily functioning. We can see that most of those negatively affected were in Global South. However, in the European countries, there is still an issue, it's still a problem, and whilst mental health is generally one of the more neglected areas of health, we can see that the climate change issues in terms of mental health are only starting to emerge, and they definitely require more attention, because here we are looking at the whole generation that is growing up in the uncertainty of the future that is affecting their well-being. Another group or groups that are highly vulnerable to climate change are farmers and also traditional communities, and they're vulnerable through the impacts on their livelihoods and on the economic well-being, but also the mental health effects. And especially when it comes to the north of Europe and the traditional communities such as reindeer herding communities in the north of Finland, the levels of depression are staggering. It's between a third and a half, according to various reports. But also in terms of physical health, then exposure to ticks and mosquitoes and the potential of vector-borne diseases might be increasing among those who are working in the fields or in the forestry. And many of those, especially in the south of Europe, happen to be informal workers, so the most vulnerable groups coming often from outside of Europe. And just to show the maps at the bottom are showing the estimated income change for farmers with and without adaptation, and then left-hand side is showing the decrease of income if no adaptation measures are being taken, where the more purple the color, the sort of the higher the decrease, with, of course, the impacts on livelihoods, quality of life, and also mental health impacts. Some of the vulnerable groups, such as, for example, the lower income groups, might be exposed more to climate hazards through the quality of housing and the quality of the living environment. In 2012, a Europe-wide survey was looking at them, asking people if they are able to keep comfortable or comfortably cool in their home during the summer. And the results were split according to income. So what you can see on the graph is that the average for a given country is the middle black line. The green is the group of the lowest income, and here the purple is the group of the highest income. So what you can see that, for example, in countries such as Bulgaria, Greece, Italy, or Spain, nearly or over double the number of people in the lowest income were unable to keep their home comfortably cool in the summer compared to those on the highest income. So it really shows the disparity that depending on your levels of income, you might be comfortable or not in your home, with possibly the implications for your health if you also happen to be physically vulnerable to heat. What we also see in an Europe-wide assessment is that there are inequalities in terms of the access of some of the vulnerable groups to green spaces, the sort of the natural coolants in our cities. This varies from location to location, but the general trend is that the neighborhoods of lower socioeconomic status have on average less green space, and green spaces of lower quality, so sort of less inviting to go there and cool during the hot summer days. It's also important to note that many vulnerable groups require specific design of green spaces to be able to access those. So wide paths, even paths, availability of toilets, availability of baby changing facilities, and so on. These are the factors that decide whether someone would decide to go and use the green space. We at the EEA, we looked at the exposure of the facilities catering for the vulnerable groups across Europe to two different climate hazards. So we looked at the exposure of schools or educational facilities and healthcare facilities. Firstly, in relation to flood risk areas, and it seems that potentially every 10th school and every 10th hospital in Europe are located in an area that might be at risk of flooding, just with the caveat that this data set does not include the flood defenses, so we don't know what the reality is, but that's the sort of worst case scenario. We also looked at the sample of 100 European cities at the location of schools and hospitals in relation to urban heat island. And the results were that nearly half of the hospitals and 4 out of 10 schools are located within the urban heat island intensity of 2 degrees or more, exceeding the regional average when it comes to temperatures. And the final piece of analysis was looking at the presence of green spaces around schools and hospitals. And this was actually much, much lower than the average for the European cities. On average, European cities contain around 42% of green spaces. The green space in the immediate surroundings of schools and hospitals were only respectively 9 and 16%, sort of showing that these areas, these facilities sort of pay the price for their sort of central location by not being surrounded by the green areas, and really showing the urgency of the need to adapt those facilities to higher temperatures in the future. So that was just a sort of a bit of a sketch of a few issues, and I think it's really showing the need for development of equitable responses and preventative measures. And I really like this cartoon because I think it very nicely shows that if we provide the equal response to everyone, it might not necessarily meet their needs. If we give everyone the same sort of bicycle for some groups, it won't really do anything. So we need to sort of look at the solutions that would cater for the vulnerable groups and meet their needs, and ensure that the health outcomes for them are, well, no worse than for other groups. Just very quickly looking at the European policy, there's been an increasing emphasis on vulnerable groups, on social inequalities, and on protection of vulnerable groups. So the whole European Green Deal is based on the principle of just transition, that as we move towards the low carbon economy, we should not be leaving any groups or any areas or any regions behind, that they should be given a bit of a helping hand, also in the financial sense through the Just Transition Fund, to join in for this transition. Then European climate change adaptation strategy is introducing this notion of just resilience without really explaining it, and just stating that it's essential to achieve the resilience in a just and fair way, and that we need to draw on science to understand the nexus between climate hazards and socioeconomic vulnerabilities and inequalities. It also states that the adaptation measures need to consider the differences between different groups. This is also reflected in another initiative at the European level, the so-called Mission on Adaptation to Climate Change, including Societal Transformation, whereby funding will be provided to 75 regions for development of adaptation strategies and their implementation. And it needs to be done with the recognition of the vulnerability and inclusiveness of the governance processes. Earlier this year, we looked at what's happening at the national level in terms of the policies. We carried out an analysis into national adaptation policies and the national health strategies of the 38 member and collaborating countries of the EEA. And one of the aspects we're looking at was which types of policies are being planned through those strategic documents. And as you can see, about a third of them are specifically including actions that are aiming at identification of the groups that are vulnerable to climate change. As a bit of a side note, what you can also see on the graph, where the blue bars are representing the number of national adaptation strategies and the green bars are the national health strategies, is that the coverage of these issues related to climate change risks and health is much higher on the adaptation side of things, in the adaptation documents, than in the health strategies. And I think that was one of the lessons learned from this exercise, that climate change risks to health are very much covered from the climate adaptation perspective rather than from the health or public health perspective. And here just a few examples of how this consideration for vulnerable groups is included in various national policies. So, for example, in Germany, the adaptation strategy is based on the vulnerability assessment. The national adaptation strategies in Finland or in Spain, they draw attention to farmers and traditional communities as vulnerable groups. In Sweden and in the Netherlands, the prioritization of adaptation is based on the vulnerability assessment, and so on and so on. So many of those national adaptation strategies are giving recognition to the vulnerable groups and their need for protection against the changing climate. But of course, long-term planning is just one part of the story, and dealing in the case of emergencies such as heat waves is another thing. WHO Europe have looked at heat health action plans, and in the European context, 16 countries reported having an existence of such a national plan, and most of them are actually looking at vulnerable groups. And the vulnerable groups that they target are the elderly, the people who are sick, people who are working outside, and also, interestingly, people exercising outdoors. This overview also includes a number of examples of practical solutions. For example, the active surveillance by general practitioners or out-of-hour calls to monitor vulnerable groups and collect information about their health. So that's something that is being implemented in France and in Italy. Sort of going down the governance levels to the local level, when it comes to adaptation to climate change, the local level or the subnational level is recognized as the sort of bedrock of adaptation. And many of the national adaptation strategies are saying that the means of the implementation are actually at the local level, because it's adapting to the locally occurring impacts and taking into account the local situation. So looking at the European cities in one of our previous reports, many of them identified vulnerable groups, and the most frequently recognized vulnerable groups are the elderly and children, those with health issues, and those living in poor quality housing. However, this recognition of vulnerable groups mainly happens at this stage of the vulnerability assessment or the impact assessment of what may happen. A researcher from the University of Twente, Diana Brecken, looked into climate change adaptation plans across Europe, and she specifically looked also into the equity and justice aspects of those. It's something that has not been published yet, but she kindly shared the results. So as you can see, there is an equity or justice issues considered at the stage of the impact assessment. in some cases also in the selection of adaptation measures, but then dark blue is getting smaller and smaller when you look at the monitoring and evaluation, whether a given adaptation response has worked and the participation of those groups. So we're not there yet where we can see the implementation of actions and a solid evaluation, what actually works in terms of protecting the vulnerable groups from climate change. Also looking at the local adaptation planning, we can see that many of the actions that are planned by the cities are really sort of preparatory in nature, that they involve things such as community engagement and education, but the actions targeted at the most vulnerable are not really making the top 10 types of actions that are being planned by cities. Nonetheless, when we look at the local climate change adaptation planning, health is one of the main focus areas. It's the fourth most commonly targeted sector by the cities who are signatories to the Covenant of Mayors for Climate and Energy after water, land use planning, and civil protection. So health is sort of firmly on the agenda in local climate adaptation planning. But what we can see is that its adaptation at the local level is still very much sitting in the planning departments, in the environmental departments. So by its nature, is very much concerned with the physical, technological solutions and so on. We looked into the reporting of the signatories to the Covenant of Mayors for Climate and Energy. They report on the actions plan, and they mention which departments are involved in that and which stakeholders are involved in that. And we see that the involvement of the departments dealing with social care and health is quite small. And when it comes to implementation of actions, but also when it comes to the planning of adaptation. So there is a big engagement of private businesses, of citizens, but when you look at the medical and social care providers, it's in the minority of planned actions that they involved. So I think what we can see in general is that at the European level, there is increasing synergy between the areas of climate and health. We can see that emerging in the national strategies, but when it comes to the implementation, which largely happens at the local level, these agendas are still very much disjointed. And also here the cities were reporting to an initiative called CDP, previously Carbon Disclosure Project, on the consideration of co-benefits of adaptive actions. So many of them see improved public health as a co-benefit of various actions leading to adaptation to climate change. But the issues, for example, of social inclusion and social justice, job creation, poverty reduction, they are somewhere really at the bottom of the list. So they are not the ones that are obviously coming to mind when you plan a new flood protection system, for example. So in this final part of the presentation, I just wanted to show you some examples of actions supporting equitable responses that are looking at vulnerable groups. And I think the first step to actually address the needs of the vulnerable groups is to identify them. And this identification can happen at different scales. There can be the national assessments. It can happen for individual cities. It can be done in a single village. And it could be done in different ways through this sort of top-down indicator-based approach or very bottom-up approach when through interviews, through focus groups, through interaction with various stakeholders who can help to identify who they think the people who are really at risk are. But here we have some examples of mapping of vulnerability. And actually one of the examples is coming from Berlin. and we frequently use it as a sort of a good example of how the environmental inequalities can be approached, where a map is being developed providing information about different environmental hazards, air pollution, noise, but also then issues related to bioclimate or the thermal load, and it's being overlaid with different types of social characteristics of the population, helping to identify the hotspots where both the environmental load of problems and the social load of problems are high and which should be prioritized. And unfortunately, we don't follow up on this example, so don't know what then implementation is in that case, but it looks like a very useful exercise to identify the vulnerable and pressed areas. One of the key ways of increasing the adaptive capacity and the ability of people to act themselves is raising the awareness among the public. And for example, WHO Europe every year is launching the Keep Cool campaign, highlighting some simple ways how it's possible to keep cool. And I was reading this research article about self-perceived vulnerability of older adults in Lisbon, and actually the awareness of the risks associated with heat waves and high temperatures was one of the factors that was making them more or less vulnerable. So this sort of awareness raising aspect is quite important. However, it's not just the general public who should be aware of the risks associated with climate change and extreme weather events, it's also then health professionals. We have a couple of examples of initiatives looking at raising the awareness of climate change in the health community. One is again coming from Germany, this Planetary Health Academy that is providing education and training for health professionals. The other one is the Nurses Climate Challenge Europe, whereby nurses can become champions for climate change as the profession that is trusted both in the medical and health community, as well as by the general public. They can become the sort of trainers, so to speak, or awareness raising champions. Also, recently, the Association of Schools of Public Health in the European region, ASFE, they were leading on the development of a so-called joint statement, focusing on the need for education and training for public health and wider health workforce on climate change and health. So the way it's done through the European Health Policy platform. It's a platform mainly for the civil society organizations and professional associations in the field of health, organized by DG Santé. And these joint statements provide a number of actions and recommendations how different institutions can act, what they can do to act on a given topic, in this case, the training on climate change and health. And finally, a sector that should not be forgotten in this and that takes care of many of the vulnerable individuals is the social care sector. And we have case study, for example, from Sweden, where the staff in facilities, residential care facilities for the elderly, were trained on the dangers of heat waves, resulting in a reduction of the mortality in the years following after that. And some other actions were also taken, such as installation of solar-powered air conditioning in the social care facilities to reduce the temperatures. And yes, effective heat action plans at various levels. We have, again, examples from different cities. For example, from the Kassel region in Germany, whereby older people can receive a phone call telling them the weather is likely to be hot, this and that you can do to make sure that you are safe in this hot weather. In Hungary, the local action plan, for example, takes care of the outdoor workers and makes sure that they don't work during the periods of hot weather. An interesting example is coming from Paris, where the Paris Resilience Strategy or the Paris Adaptation Action Plan is really emphasizing the notion of solidarity between people, and that that networks of volunteers should be connected with those in need of support to provide people with water, to knock on people's doors and check if they're doing okay in hot weather, for example. Another sector maybe that should be engaged in that agenda of protecting health from climate health impacts is flood risk management, and that's one of the sectors when it's very easy to do maladaptation or take decisions that may have negative consequences for the vulnerable populations, especially the lower income populations. So, for example, then traditional cost-benefit analysis are a very good tool for deciding whether flood defenses should be located, but normally they don't take into account the characteristics of the population. And also the assumption is that as long as there is a greater benefit for the society, we can accept a level of inequality. So introducing this element of vulnerability assessment in cost-benefit analysis is one of the measures that could reduce the exposure of vulnerable groups to flooding. Another factor is the affordability of the flood insurance, and also affordability of flood defenses for individual homes, such as, for example, those floodgates that can be installed. And just very quickly to run through results of an interesting research paper I came across, is that in most of the European countries, flood insurance is very much market-driven, which means that in areas of high flood risk, then insurance companies can set high premiums that are corresponding with the high risk, which means that insurance becomes unaffordable to many of the lower income groups. Only in a minority of European countries there are more than compulsory flood insurance and support from the state in case of the flooding happens. And this results in an unaffordability of flood insurance. So here we have a map showing where flood insurance is particularly unaffordable to various groups, taking into account the flood risk and the costs of the insurance. And those researchers also modeled those costs in the future, and they modeled how this unaffordability is likely to change in the future, showing that in many parts of Europe this will increase by 2050 or 2080, given the increases in the flood risk. And what does it mean? It very much translates into the health of people who might not be able to afford the flood insurance, from the physical health and potentially living in a house that is damp after the flooding, causing respiratory infections, for example, but also the mental health and the uncertainty and the fear of the next rain or the next high water coming can have disastrous mental health consequences. A similar issue is with the unaffordability of those property-level flood resilience measures. These floodgates you can put in the door, or some so-called wet-proofing measures where you can, for example, have waterproof doors or raise your electricity installation above the expected flood levels. We can see that for most of European countries, they are only affordable to the highest income quintiles of the population, and in many countries they are not affordable actually to anyone. And as flood risk increases in many areas, this unaffordability will continue in the future. So what could be done? We could shift the insurance schemes into more solidarity-based schemes. In terms of the property level flood protection, there is a need for some coherent action from the housing sector. So it means that there are many different sectors that should be involved in that matter. It's not just a matter of climate change adaptation and public health. It's really a very cross-cutting issue. And I think the next examples are also showing that in terms of issues such as urban design, landscaping, planning, we have examples, for example, identification of particularly vulnerable locations, such as in Trnava, in Slovakia, and sort of a neglected green space was selected for tree planting to provide the sort of green oasis between kindergarten and retirement home, and in the area where most of the population lives in high-rise block of flats, really prone to overheating. We've seen some successful stories, for example, from Augustenborg neighborhood in Malmö in Sweden, where the previously frequently flooded neighborhood, also inhabited by lower income people, many of them non-native Swedes, after the installation of the stormwater management system and the sort of collection of water in ponds and diversion, it not only resolved the problem of flooding, but also made it a more attractive area to live. People stayed there for longer and enjoyed a higher quality of life. What we can see in various adaptation strategies, for example, in the city of Paris, one of the actions is to keep the parks and gardens open all day in the events of heat waves, to make them accessible to people who would wish to go for a walk in a cooler environment rather than stay in their hot house. And we also see some guidance on ensuring the adequate access to green space. For example, the WHO advocates that no one should live further than about 300 meters from a green space of a decent size. So whilst there is no sort of coherent guidance in European countries or cities, we also see examples of initiatives that are advocating for the presence of green spaces very close to people homes, to improve their general health and well-being, but also to help to adapt to climate change. Also in the more direct living environment, we see nice examples, for example, in Dresden, where a consultation was carried out with the residents of low-income area, which sorts of improvements in the flats that they live would reduce the overheating. There are some interesting new concepts coming, such as district cooling, whereby cool water from rivers is used to cool the houses or various facilities, or for example, an example from Amsterdam, when green roofs are being installed on social housing to reduce the risk of flooding in those areas. Of course, it's also important to engage the vulnerable groups in the decision making, and an example of that is coming from the city of Prague, where the residents of one of the districts were engaged in identifying the areas that are particularly hot and uncomfortable in the city, and they did it through participatory mapping and identified rather unexpectedly bus shelters as one type of the hotspots that really required some cooling, or engagement of the groups in creating the green spaces, such as this being done through an initiative in Geneva, Genova in Italy, where residents, refugees and immigrants are involved in creating the green spaces. Greening of schools is another type of initiatives that is happening quite a lot in Paris and in Flanders, for example, and in some cases these facilities are also open to wider communities. And also resilient healthcare systems. Then a very recent declaration of the G7 health ministers under the presidency of Germany included several paragraphs about the climate resilient and carbon neutral health systems. So that really sort of draws attention to the political attention to the need of ensuring the resilience of the health sector. Also, WHO Europe presented this Zero Regrets paper at the Conference of the Parties in November in Glasgow at COP26, also including the point about the climate resilience and sustainability within health systems. And we do have some examples of that. EU-funded project, Life Resistal, has just started, that is looking at increasing the resilience of several hospitals in Europe and also spreading the knowledge to their network of stakeholders. We also have a case of a hospital in Denmark that is still at the development stage, that is including the stormwater management into the design and the greening and the access to the green spaces for the staff and the patients. And finally, protecting mental health of the vulnerable groups. WHO has only a few weeks ago produced this policy brief on mental health and climate change, really calling for the inclusion of climate change considerations in mental health practice, but also bringing in the psychological support and mental health support into the actions associated with climate change and the responses to disasters and so on. And in the Observatory, we have a nice case study from Finland, whereby 3 NGOs are working with vulnerable populations, such as young people or farmers, trying to ease their climate anxiety and help develop mechanisms that can help people deal with that. So just 2 final slides. I think from our perspective, what emerges as the main knowledge gaps is, first of all, how the different aspects of vulnerability or social inequalities, how they interact when they are put together in terms of then poor health and age combined with low socioeconomic status and so on. What are the synergies there? What do they mean for the overall health outcomes of associated with climate change? Also, climate change hazards are just a part of the story, and for example, in urban areas, when they are combined with high levels of air pollution, that can have really disastrous consequences for human health. So what are the interactions between climate change hazards and other environmental pressures? The mental and occupational health aspects of climate change are, at least in the European context, not so well recognized and a bit under-researched. And also the effectiveness of solutions. Many of the solutions are still at the planning phase. The implementation of adaptation to climate change in general is not really so widespread yet. And the implementation in relation to human health and to vulnerable groups is probably lagging behind even more. And we need to know what works to be able to share this knowledge and to protect human health. As an example, we know that in 2003, at least 15,000 people died as a result of a heat wave in France. In 2018, this number was 580 people, so it was a huge decrease in mortality due to the actions that were taken. However, we don't know what was it that actually worked. We don't know if it was the most effective way of doing things. And this element of monitoring and evaluation is really necessary. And finally, yes, how do we measure this progress towards just resilience? When do we know that we are well adapted to climate change? And yes, what does it mean that we are becoming resilient and we've achieved justice through that? So how can we measure that on the way? Yeah, so this is just a concluding slide. So what we see in the context of climate change is that the most vulnerable groups are the ones that are already at disadvantage through their personal characteristics or through their position in the society. if the equity considerations are not taken in adaptation, it may mean that these inequalities persist or even become worse, or even new inequalities may emerge, such in the case of, for example, flood insurance. We can see the shift in the policy towards the consideration of vulnerable groups, but even though there are many examples of actions, the implementation is still rather scarce. And the final point is that if we want to address the climate risks, addressing vulnerable groups, it cannot be done by one sector alone. It really requires many cross-cutting actions in sectors that can seem very far removed from public health or very far removed from climate change, even such as building design or urban design. So that's it. Thank you very much. And I'm looking forward to questions.
Thank you so much for this great talk, Aleksandra. It was a comprehensive overview, and I really enjoyed listening to you. Thanks a million for that. Now we have the chance, the opportunity to ask questions, exchange thoughts. We can do it on two ways, either here in the lecture hall. The front rows, the rich ones, have microphones. The back rows don't, but we have another one which is then transferred. And of course, we have WebEx. Just put the question in the chat. We will read it aloud and get into a dialogue with Aleksandra on that. So the floor is open. I welcome you and looking forward to your questions. Maybe I will start with a question before. Your focus was the interaction between public climate change and social disparities, social disadvantages. This is a classical area for health and policy. So it's not only the sector, it's the housing, it's the education, it's transport. How do you do this on the European level? There are different agencies, different ministries. How do you address those? Do you have special channels, special communication ways? How do you deal with this?
I think that's the initiative that I'm involved in, this European Climate and Health Observatory, is an example when different parts of the European Commission, different European agencies, and also different stakeholders are coming together. So, as I mentioned, in the partnership, we have the different partners from the Copernicus program looking at Earth observation to WHO Europe, very much sitting in the health and public health agenda. So I think that's one of the vehicles that we have that provides also a forum for discussion. We are meeting frequently with the partners, and they bringing in their expertise and their agenda. So I think that, especially given that it's been the European Commission initiative and driven by DG Climate Action on one hand and DG Sante on the other hand, it really shows the sort of will to break the silos and to make sure that the relevant sectors and stakeholders are involved in the discussion.
All right. Thanks a lot. May I ask an associated question? So it's about networking, addressing different institutions and committees. And what about the products? Do you develop and deliver different products, or is one size fits all?
Well, I must say that the observatory started just over a year ago, and it's been, it had a bit of a limited capacity in terms of staff. So it's been mainly me with some support of more ad hoc colleagues. We've been working on developing the indicators, the case studies, short reports, short evidence reviews, web-based content, but also drawing the knowledge from our various partners. So I hope that various stakeholders can find interesting information. What we've done when we just started on the observatory, we carried out a consultation with our networks at the EEA, with the networks of the country representatives, asking them which types of outputs would you be interested in, and those indicators and case studies as a sort of inspiration, as well as some policy analysis were what they were interested in. So we are hoping that we are meeting some of their needs at least.
Well, of course, thanks a lot for the quite helpful information, because we are trying to build up a health information system on climate and health as well. And of course, we looked into your system quite intensively in preparation of your visit. And I found it very inspiring that you have different groups of informations, of knowledge, of data for different target groups. I liked it quite a lot. It's great. Some questions from the...
Yeah, thank you, Aleksandra, for a very rich talk, I have to say. Fantastic. When you talked about evaluation and indicators, I mean, if there are some things are actually known, I think, as green islands or so, we know that they are important. So what are certain time schedules that it would need to evaluate a certain measure, for example? I mean, when we look at health indicators, the outcome of some interventions in prevention, it may take years. But obviously, we know that the 2-degree goal is already not possible anymore. So, I mean, there's urgent need to do a lot of things. So what would you, if you talk to politicians, which kinds of evaluations are really needed, which should be stressed on, and which measures are obvious and we don't need to evaluate them?
Yeah, it's a very good question. Thank you. And I'm not quite sure if I have the immediate answer. And thinking about the political perspective, it would be probably the evaluations of the initiatives that are happening here and now, and that, if successful, can secure the votes for the future elections. But like you said, it's very different time horizons. So we are at the moment really scratching our heads, thinking about what sort of indicators of adaptation or of resilience we could even think of, going beyond health issues, but in general. And it's really difficult, because, for example, if we want to achieve a reduction of population living in flood risk areas, that won't happen overnight. It's a result of building flood defenses, maybe relocation systems. So I think that's something that should be evaluated in decades rather than immediately. If we think about the effectiveness of health action plans, I think that's there is a need for a quick evaluation to be able to prepare better for the next year and the next summer and the summer to come. So I think it also depends a bit on the nature of the hazard. So.
Yeah, perhaps I want to make it even clearer, the case here. So when we look back at this pandemic that is currently running, and we look now particularly to Germany, because of course, obviously, I have most of the experience from this country. As scientists, we want things to be evidence-based. But of course, you have to react often in urgency, and you can't wait for the evidence. That's for sure. And so you have to act, and some things are obvious. But what we're seeing now is that some politicians may even turn this back. They say, oh, the evidence is lacking for this, and therefore we won't support this measure anymore. And so, this is it could be basically it could be a backdraw for our interventions, for our goals, that some politicians may turn this around. Is this something that you're also observing in this area that you are working around? It's a danger that I have never seen before. Yeah, I've only realized this danger since this pandemic, that politicians might turn it to their own, to basically to thereby make the case that they couldn't act because the evidence was lacking, and so they didn't need to act, and they wouldn't act in the next 10 years or so.
Mm-hmm. Yeah, I think that's in a way we have then, I think, apart from a very small minority of climate skeptics, that we have the overwhelming evidence that climate change is happening and it requires action. But in terms of what should actually be done, I think that's that's the actions that are either relatively low cost, or the actions that are sort of no regret options that would bring some other co-benefits. They are the ones to prioritize. In the first case of the sort of relative low cost and high effectiveness early warning systems, and then proper implementation of those. And in the second case, for example, then built environment improvements that can not just reduce the temperatures, but reduce the noise coming from the streets, improve the general quality of life, or introduction of green spaces that can also bring other benefits apart from those. But I haven't actually come across this, but it may be through the nature of my work as well, that it would be used in a sort of political setup, that there is not sufficient evidence that this works, that therefore we're not doing it. I think that it might have been the case more with, like, in my previous life as a researcher with green spaces, whereby presenting the results of the research into how green spaces are cooling the city, presenting that to the city authorities, the response was, well, but it's green spaces are nice to have. They're not essential, so it's not something that we would prioritize. And I think that this mindset might be shifting with the indeed increasing body of evidence and the sort of health and financial and economic benefits brought by certain solutions, that maybe they're not just nice to have, maybe they essential to have.
Very much. There are two more comments. One from the lecture hall. Would you like to?
I don't know, is this working? Yeah. Hi. So we talked already a lot. Just one more thing that came up when you talked about the gaps, about measuring progress and about how to measure a just resilience, which is kind of our goal, right? And especially there, like from when you said resilience, what is it even? How do we measure that? But then also the part of just. So maybe in your opinion, or if that's something that the Observatory is also already thinking about or developing, how do we measure whether our adaptation plans or measures also of national public health systems are actually just? What would be, in your opinion, something that would do it justice, to say when is an intervention, when is something that we do to prevent risks or reduce risks, when is that a measure, when can we deem it as just? How do we measure that? Because I think it's so hard to grasp, right? Like, how do we measure equity? That is a big challenge. That would be one. And then maybe one, I think it's not really probably a question that can be answered right now, but we have this whole concept of health in all policies, and I think there's increasingly also calls for equity in all policies. And I think that is something very important. And whether you think that is possible, or and yeah. Thank you.
Yeah, thank you, and excellent questions. When it comes to measuring resilience or adaptation or just resilience, I think we are just at the beginning of the journey, and we've been at the EEA more broadly for the past couple of years. We've been trying to think what sort of indicators can then be in relation to adaptation more broadly, and being also limited with the data sets that we have at our disposals. And I think maybe some of those assessments, like looking this year, we have 10% of schools in flood risk areas, and following up on that, is this proportion changing in 10, 20, 50 years time, because that's the sort of lifespan of the built infrastructure. So looking at the exposure of different places and so on. When it comes to measuring the equity, that's even more difficult, and I've been looking into the sort of flood risk in areas of different age makeup and different levels of unemployment, because the Europe-wide data sets are really missing, and the early conclusions are showing that indeed in the European scale, there seems to be the case that the more vulnerable populations are having a higher likelihood of living in area at risk of flooding. But then if you want to measure if we are going in the right direction, would going into the situation that's the sort of population makeup in areas in and out of flood risk areas is more or less the same. Is that a desired output or not? Sort of evening out the distribution of risks across the society. Is that, it's more equitable, I suppose, but does it really work for those that were not at risk before? And so it's quite a simplistic example, but I think that it's quite difficult to. It's much easier to observe what the current situation is than even imagine what the sort of most equitable outcome would be. The no risk for anyone would be the ideal situation, but and. The second question on equity in policies, I think that's a very noble goal to have, but whether it's attainable, and especially being in a capitalist market-based society, it's a different issue.
It's true, not only for the aspect of climate change, for all other health aspects as well. But still, it's an important role of us just to pinpoint this problem and to keep the awareness on this as well. There's some questions from the WebEx, from the outside world?
Yes, indeed. Quite a few comments on like, thank you and fantastic talk. I think I want to pass them also on. But there are 3 questions I can see at the moment. The first one asks, aren't there also vulnerable communities? How would you motivate a poor municipality with a high level of environmental risk but scarce financial resources? Is this covered by national or European funds?
Yes, so how to motivate a municipality with scarce resources but high level of risks? I think that yes, that there is European support available. In some cases, it's a financial support. In some cases, it's more in terms of capacity building or knowledge exchange. So I think that initiatives such as the Covenant of Mayors for Climate and Energy on the climate side, or the Green Cities Accord, or the Healthy Cities Network of WHO are places where information and knowledge can be found. I think also by sharing examples and sort of providing the inspiration for others on various activities, and ensuring that a given city does not need to necessarily commit resources into investigating the range of options that are possible, but can just see, well, the cities of a similar profile have done this and that. Maybe this is something that we should look more specifically into. But also there are indeed the European funding as well available for example, the LIFE project, which is more about the implementation of different solutions. And at least in the case of climate change adaptation, a lot of research projects are done not just for cities, but with cities, and engaging them as partners in the projects, where certain solutions can be, for example, experimented in a sort of living lab approach. So.
Yeah, the next question here is, do you have any data on how heat waves change the health and social behavior of people? For example, are they staying more at home, or instead of going out and meeting people, avoiding outdoor activities, sports and things like that? Any data on that?
No, and unfortunately, I'm not aware of any data, at least at the European scale, that would exist. And we see that in many of the future modeling of the impacts, not just of heat waves, but for example, the UV radiation, and whether with the changing climate people would stay more outside and enjoy or endure the sunshine, or whether we reach a certain point where the temperatures are becoming so uncomfortable that people would actually go back inside. So then the sort of the projections of heat exposure, but also of exposure to UV radiation are a bit a bit vague, and they can both actually go actually both ways.
Yes, and there is a question, how thoroughly are the measures checked for long-term sustainability? Using water from rivers to cool urban spaces heats up the aquatic environment and thus has ecological knock-on effects.
Yeah, and I think that's a very good point, and I must admit that I did not investigate in a huge detail how things are being done in Paris or Tartu in Estonia in terms of what's happening with this warm water. But I know that there are also some closed systems that exist that can be used for cooling buildings. There are some examples in Rotterdam, for example, where the water is being stored in a sort of artificial aquifer under the building. But indeed, there are some solutions that should be considered with caution. And I think indeed a case like that of the warm water potentially disrupting aquatic environment, it might have been the case with some sort of server cooling facilities where the water was causing negative effects.
Thank you very much. We are approaching the end of the question and answer session now. There's one question which is a difficult one, but we ask them to other speakers as well within the colloquium. At two levels in your case. One is, if you could counsel us, what would be the three most important things for us to do to tackle the problem of health inequality and climate change? It's tricky.
Yeah.
Or maybe we start with the second part of it. Look, you are coming from the European perspective. We are a National Public Health Institute. What would be most helpful for you in terms of data or information or actions that could help your work to be as effective as possible?
Yeah. I think that in general at the European Climate and Health Observatory, we are looking for closer engagement with national public health institutes, and I could see that also in the roadmap by IANFI, where there is an expressed wish for closer collaboration between the public health institutes and a range of stakeholders, including the observatory. So I think the feeling is mutual and the appetite for collaboration is there on both sides. I think what would be incredibly useful for us would be, first of all, knowing how we can support you, how we can complement the knowledge and activities that we have, how we can champion what you do, and how we can spread the knowledge about it. So also, and it's my usual plea to audiences, if there are any activities in Germany in the field of climate change and public health that you see as good case studies, any solutions that are implemented, something is working well, and it could be about monitoring of infectious diseases, it could be about heat waves, it could be about flooding, it could be about pollen awareness raising, and the topics are really quite diverse. We would be very happy to have them in the observatory and to share this knowledge for others. You could see that there were plenty of examples in the presentation I gave, and I think the more examples we have, the more different cities, countries, and regions in Europe can learn from each other, and instead of using the time and resources for inventing solutions, maybe we start to develop a sort of a pool of knowledge where people can draw for. So I think that would be my request in terms of the things to be done. I think it's maybe indeed raising awareness of this need of health and equity in all policies, and looking at climate change aspects among broader sustainability aspects in discussions with stakeholders from various sectors, and raising the awareness of climate risks, both the sort of extreme weather events and short term, and the longer term in the public health community, but also in the health community and about the particular risks for vulnerable groups. And yes, I think that engaging in research on that and drawing on the extensive data sets that you have available to see where we are in terms of those impacts on vulnerable people, and also what works.
Sounds perfect, and quite, thank you for the support. Because two of the goals we are doing within the department of NCD is to focus on social inequalities, as well on enlarging the databases we are working with, and which will be delivered as well to research, to local authorities, and of course to the European Union. So thank you very much for this advice and tips how to proceed. It's quite helpful. Thank you. So we are reaching the end of the Q&A session. I really would like to thank you again, Aleksandra, for this wonderful talk and the discussion afterwards. It was quite a pleasure for me to guide you through this session this afternoon. We'll see what the next steps are. We have a small reception afterwards in the foyer, and you're cordially invited, all of you, here in the hall. I would like also to thank everyone outside via WebEx. Thank you for the input and the questions from outside. It was quite helpful and interesting. Let me just announce the speaker of the next week, which will be Maria Nera from WHO Geneva. And she will be talking about the health argument to tackle climate change. Next week, same time, same location. Looking forward to see you then there. And also, thank you very much for the research team who is preparing this colloquium series for this excellent preparation. And thanks to all of you, especially you, Aleksandra.
Thank you.
Thank you.